be talking about Chapter 13, Professionalism. So when we look at professionalism, it is very important that people who work in healthcare are professional. It's a very hard term to define because there's so many things that go into this. So we're going to look at some of the characteristics that fall into what a professional person would be like. So one of the terms that they use in your text is caring competence. And I think that's a great term because what it's saying is that we care about our patients and we have a technical skill that is good. So not only can we do the job we need to do with the skills, but we can provide those skills in a caring manner to our patients. The other characteristics that we look at are dedicated to doing your best. And I think anytime you walk in to any healthcare facility, you will find that most people there are doing their absolute best. They're engaging with their patients or their clients or residents. They enjoy what they're doing. Are there times we get overwhelmed? Absolutely. But when we look at the big scheme of things, we really are dedicated to doing the best that we can do. And we also have to make sure we are maintaining high quality service. So it's just not mediocre. We're going to give each patient the time and are caring to take the best care of them that we can. So when we look at the terms compassion and empathy, this is one that is, I think, most important. Empathy is really a sincere concern for others. And it's the foundation of caring. So as we look at empathy, we look at certain things that we would say or do. And so we try to understand that other person's thoughts and feelings. I love the phrase, walk a mile in my shoes. We do not know what a person is going through in their life. We can't even assume what they're going through. This is the one thing that always humbles me because my patients will come in and they'll talk to me and they're telling me everything that is going on in their life. And here I'm whining about I want something very frivolous. And it brings me down to earth very quickly to realize that I'm very blessed and that I need to be present for my patients, listen to them, and try to understand where they are. We also need to be available to walk with them on that road. We're not going to fix things. The worst thing you can say to a patient is, I know how you feel, because we absolutely do not know how someone feels. The same thing can happen to two people, and we feel very differently. So when you are talking with your patient, take that phrase out of your mind and vocabulary, because you don't ever want to say that to patients. Are you done singing and humming? The other thing that we have to think about besides empathy is our attitude. And you see this every day. People either have a positive attitude or a negative attitude. And how you view a situation is going to actually reflect in what happens to you. So if you have somebody that's always saying, oh, this is awful, this is terrible, generally that happens. If you have somebody who tries to think positively and they say, well, might not have been exactly what I wanted, but I got this far. Their presence and being around them is really uplifting. And I know that you guys have held jobs in the past, and there's somebody that you've worked with that's positive, and there's somebody that you've worked with that is negative. That negative Nelly, I like to call them, they're whining, they're complaining about everything. They walk in a sour mood. They walk out in a sour mood. Anybody they take care of knows they're not very positive. Well, on the other hand, if we walk in, leave our own problems behind, because we can't bring them into the office, but be in a good, positive frame of mind, go through the day positively, and end positively, our patients can absolutely feel the difference. They feel cared for, they feel like you're listening to them, and that they matter, which is so very important. When we look at problems, again, is it always, again, the woe is me, it's always something, or do we look at a problem as an opportunity to learn? Honestly, the biggest learning in my life has taken place when I've failed. It's great to always have things go well for you. It's great to be able to say, oh yeah, I've never made a mistake. But we have. And personally, my learning through my failures has made me more successful in where I am today. So in your text, they talk about a gentleman by the name of Mr. Chang. He's an 86-year-old gentleman who spent most of his life in Hong Kong. He moved to the United States about 20-some years ago. His wife died a few years ago, and his children live somewhere else. Other than being new to the country, this really is a lot of our older patients. You know, our older patients are lonely. They don't have a lot of people surrounding them. So he's in this nursing home. He can be very difficult. And again, our nursing assistants out there, they know exactly what we're talking about. So they can be cranky. They can be just miserable. And how we approach that patient or resident is going to affect how Mr. Chang will work with us. So they give you an example. Anne absolutely hates going into Mr. Chang's room. He complains and he grumbles. She just gets her stuff done, doesn't converse with him, just gets it done and gets out. Where Charles, on the other hand, did something very different. He went out and he actually researched Mr. Chang's culture. He was able to talk to him and talk to him about his family, and that, they could develop a good relationship. I want you to stop and think for just a moment. This coronavirus has really gotten us thinking. So let's say it's you, sitting in a nursing home all by yourself, no one around to come and visit you, no one to stop in even now and then because your family lives 12 hours away. Your wife or husband has passed and you were there by yourself. I want you to think about the loneliness of that person. They've been taken out of everything that's familiar in their life, into a nursing home where they don't even have control of a schedule, really, very much. Their food is fed to them. We don't have a lot of selection. I mean, they do, but it's not great, okay? It's for this gentleman who comes from Hong Kong, his culture is really not represented well there. So no wonder he's miserable. And so by listening to him and finding out what's going on with him and talking a little bit about his culture and what his family was like and what it was growing up in what was it like growing up in Hong Kong? Imagine the connection that Mr. Chang might have with you. So just going out of your way to learn a little bit about the patient's culture, being nice, being professional, and talking to the patient makes a huge difference. So how do we demonstrate a professional attitude? Well, they give us all kinds of wonderful little selections here. First of all, you have to approach your work in a positive manner. I'm going to tell you, there's days you just don't feel like it, but you got to put your happy face on because it does make a huge difference. I don't care what profession you're in. If you go to work miserable, everybody who works with you knows. So be positive. I don't mean be fake. I just mean be positive. You have to be committed to what you're doing. The day that you don't like working in healthcare anymore is the day that you need to resign, because our patients deserve better. If you're not happy in what you're doing, it's going to reflect in your care and your attitude, and our patients don't deserve that. So it's very important that you are committed to your work. Realize and recognize what impact we have on patient care. That's really important. We can make or break that patient's day. We can go in there and treat them terribly, and they're going to walk out in a horrible mood, feeling like nobody's listening to them, that we could care less. Or we can go in, ask them how they're doing, ask about their family members, and make a positive impact on that patient's day. So it's really important to think about that. Use objective approaches to certain situations. I can talk, I really can. Again, look at these things as these opportunities, as positive actions. Again, yes, it could be negative. Oh my gosh, Mr. Jones is coming and he is so crabby. But guess what? We may not understand what Mr. Jones is crabby about. If we take 5 minutes and talk to Mr. Jones to see what's going on, we might find out that he doesn't have money to pay his electric bill. He's got a sick son, and he's 3 hours away, and he can't get to him to see him. There's so many things that can be affecting people. And when we assume they're just crabby, nasty people, it really isn't. That's not the best for our patients. So we need to take the time to figure out what's going on with them and maybe why that they have such an issue going on. I know in the chapters previous, they talked about that objective approach to situations, kind of how to use that problem solving, model. I think it was in chapter 1, but you can go through that process if you'd like. But the other thing that we need to make sure that we're doing is developing and practicing self-discipline. You need to know when you can depend on yourself to accomplish what needs to be done, both in your competence at work, but also in your self-confidence. Sometimes we go in feeling a little bit less than other people, and that shouldn't be. We should be very proud of our professions, whatever they may be. Phlebotomists, medical assistants, med lab techs, it doesn't matter. Billing and coding, administrative assistants, all of those people are a vital part of the medical office. We can't do our jobs and provide excellent patient care without every one of us, from the janitor all the way to the physician. And so we have to remember that we are important, and we're an important cog in the wheel for this patient's care. So please make sure that self-confidence comes through. There are certain professional behaviors that we associate with being, with professionalism. And so one of the first things is, excuse me. Sorry, I just had a little choking fit. So what you need to know is you represent that facility. So you are the face of wherever you work, whether it's UPMC Western Maryland, whether it's Dr. Jones' office, if it's a lab, an independent lab setting, wherever that is, you are a representative of that agency, and you need to act in a professional manner, because people will, if you're acting unprofessional, will relate it to the place that you work. So we have to be professional. We're not going to complain about work to our patients. that is the worst thing you can do, because then they're sitting there thinking, my gosh, I'm here and they're complaining about everything. I'm sure they complain about me once I walk out of this room. So don't complain. Remember, positive attitudes. If they say, you seem upset today, is something wrong? And just say, oh, no, I just, a little out of sorts this morning. I got up late and I'm a little discombobulated or whatever. And then we turn it on to a positive attitude. When a patient points it out to us, that's not a good thing. Okay? So some of those professional behaviors, be dependable. This is one of the biggest things that our employers want from you. They want you to show up, and they want you to show up on time. I tell my students this all the time. When I get a call for a reference for a job, I have never been asked in my many, many years of teaching, what was their grade point average? Nobody cares what your grade point average is. They know you graduated, so you had to be competent in what you were doing. The things that they ask me are, did you show up to class? Were you on time? And could you get along with other people? And that is very, very important. So be dependable. Let them know they can count on you. Make sure you perform all the duties that you're assigned. Some of them aren't so glorious. Actually washing the surgical instruments to get them ready to put in the autoclave. Not one of the most glamorous things we do, but we do it because it's a necessary part of the medical office. The other thing that you need to do is be flexible. I am going to tell you, you're never going to have the same kind of day, ever. Things happen all the time. Look what just happened with this coronavirus. Who would have thought over spring break that we would not be going back to classes? Never. We had to scurry. On our end, we had to get our classes up and ready, and we're still working on them. You guys had to take a totally different approach to how you're learning. And so talking about being flexible, you guys have showed this. So you guys, kudos to you. Make a check mark. You're doing great. Okay. Another thing is we need to be able to accept differences. Culturally, in relationships, we are going to have differences. Some people may do things different than you. Others may not. May do things the way you do. We're all different, but we need to accept that. Okay? We talked a great deal about this in our chapter on the cultural competence. And again, remember, our patients, we accept where they are. So if there's cultural differences, we need to learn about them, we need to accept them, and we need to work with them on that. Now, one of the things I noticed on the last test, excuse me, was a lot of you said that we have to do what patients, their cultural things do. Okay, I know that's not a very good statement, but if they are not in the best interest of the patient, the doctor would say, no, that's not acceptable. So let's say they believe in bloodletting and they have anemia. The doctor's going to say, no, that is not in your best interest. We need to get your blood levels up. Not losing blood is not a way to do that. So it's really important to realize that we accept their differences. But when it's to a point where it affects patient care, that's when we have to make sure that we are doing the best for our patient. Another thing is treat everyone with courtesy and consideration. You guys have heard this and you will continue to hear that. Practice good communication skills. We had a whole chapter with this. Asking open-ended questions. Really trying to ask, paraphrase or restate to make sure that we understand what our patients are saying. Keep personal problems separate from work. I like to use an analogy, and as I'm getting older, I'm finding that a lot of people don't know what a coat tree is. But what a coat tree is It's a piece of wood that stands up with a base, and it's got hooks on it, and you just hook your coat on it, and then, you go into wherever you're going to go. Well, I like to say, hang your problems on a coat hook when you walk into the office. Excuse me. And leave them there. Nobody needs to hear about your problems. They are there they're coming there with their own problems. So it's really important that we leave our issues behind. When we get ready to leave, then we can pick up our problems, take them home with us, and try to figure them out. But please try the best that you can not to bring those into work, because it really can affect how you work well in the office or facility. You need to be organized and plan ahead. And you need to behave ethically and set high personal standards. And we've talked about this through the legal and ethical chapter, as well as some of the others. We need to be calm, all right? If we lose it in front of a patient, the patient's going to lose it. They believe we're the professionals. So if we're getting upset and frustrated and scared, they're thinking, oh my God, this has to be bad. So as difficult as it can be, we need to have that calm persona or facade. Okay? Try to serve as a role model for good health. I kind of fail at this one. We should exercise, we should eat right, all those wonderful things, not smoke, yada, yada, yada. But we don't always do that so well. I'm still working on this one. And then we need to set professional goals and strive for continual improvement, which we do. You guys you've set your professional goals. You want to graduate in the program that you're in. Then you're going to sit for a certification. Then you're going to go to work. You are constantly going to be learning in every field in healthcare. Things change daily. So in order for us to be able to keep up and know what's going on and how we're going to treat people, we have to remain, constantly reading and doing continuing education. And that is part of being professional. There's also technical skills that are involved here. Okay. So first of all, you need to know how your place of employment works. And it's all going to be different. If you're a phlebotomist, you need to kind of understand how that lab works. MLT, again, you need to understand how the lab works. Medical office folks, coders, billers, administrative and MAs, we need to understand how a medical office works. You cannot work in a silo. So you need to realize everything you do affects everybody else around you. So it's really important that you understand how your place of employment works. You need to listen and observe carefully. Again, if you're learning a new skill, if you are learning an adaptation to an old skill, whatever it may be, you need to listen and observe. If you have a question about something at work, ask. Please don't ever assume, because you know what happens when you assume. So look and know where the employee manual is. It should be in a place that every single employee has access to. It should not be locked in an office, okay? Know those policies and procedures. It is so very important. And if you don't know, ask. Because like I said, if you assume, that outcome could be very bad. All right? Perform all your work neatly and accurately, and dedicate time to acquire new knowledge and skills. As we've said, there's going to be new things advancing every day, every week. So we have to take time to read about those, learn about them, and then learn how to do them. And one of the big things is personal or professional appearance. People forget sometimes that our appearance is the outward sign of professionalism. So if you come into work looking like a cat licked your hair and your scrubs are all wrinkled because it looks like you slept in them all night, your patient's going to take one look at you and go, oh my God, they can't even take care of themselves. How can they take care of me? So that personal appearance makes a huge difference. Your hair is clean, and if it's long, it's pulled back. Your scrubs are wrinkle free. Your pant legs aren't dragging and frayed at the bottom. Your shoes are clean. There's nothing grosser than dirty shoes, and so all of those things are important when people look at you. They are going to have that first impression, and that first impression is very, very important. One of the things there's a lot of conflict about right now is body art and piercings. What we have to remember is you can do whatever you want to your body. Nobody has the right to say you can and can't do anything. But what an employer can say is, if you have body art or tattoos, they have to be covered. And if you have piercings, the only piercings that are allowed to be, have any type of jewelry in them is one post in each ear. That is the policy at Allegheny College of Maryland. When you go into your clinical sites, your tattoos must be covered, and you only have one post earring in each ear. So if you have your nose pierced or your ears pierced above, all of that comes out. Now, if you're pierced where we can't see, we don't care, and I don't want to know. Okay? So it's very important, though. And again, it's because of the population of our office. Older people find this distracting sometimes. And so if that makes our patients uncomfortable, then we make sure our patients are comfortable and we ask people to cover their tattoos and their piercings. What I have found lately, at least in the medical offices, that people are getting more and more okay with these things. And so as long as the body art is not offensive, as long as the piercings aren't crazy, a lot of times they're allowing them to do this. So what we have said is you have to check with your policy for your office, and then we follow that. But in our manual, it says all tattoos have to be covered and one post in each ear, in each ear. Okay. The other thing that you need to do is practice personal hygiene. That means shower, okay? Make sure your hair is clean, your fingernails are clean, that you're using deodorant, that you're brushing your teeth. And I know this sounds crazy, but I can't tell you how many times I've had to talk to students about personal hygiene. You cannot wear perfumes and colognes. People have allergic reactions to them. So even hand sanitizers cannot have a smell to them. So be very careful with body lotions and those kind of things that have scents. You need to find things that are unscented. Try to stay away from extreme styles like blue hair, green hair. Again, in our policy manual, you have to have natural colored hair. So if you're getting ready to go into your practicum sites and you decide to dye your hair blue, we're going to tell you in order to go into your site, you're going to have to dye it back to a normal color. Okay? The other thing that we have to do is consider the safety of yourself and others. And so I talk a lot about this because if you have long fingernails, first of all, artificial nails are out because the CDC says bacteria can grow between your nail and the artificial nail. But fingernails should be at fingertip because some of our patients have paper thin skin, and just pushing your fingernail against them can cause a huge tear in their skin. The other thing is, don't wear hoop earrings. A lot of times people will grab at you and they don't mean to hurt you. But I'm going to tell you, once you've had a hoop earring ripped out of your ear, it hurts and there's blood. And so wear posts. Don't wear things that are going to cause harm to you. Maintaining professional distance. Boy, we're learning about that too with the coronavirus, aren't we? 6 feet. Now I've heard 13 feet. But professional distance is where we have to maintain that professional patient relationship. So for some patients, that may be 4 feet. For other patients, it may be 2 feet. We need to recognize the signs of people when they're uncomfortable that we've entered their personal space. You need to make sure, again, you're showing that caring attitude. We don't always need to have the approval of our patients. We're not their friends. We are their medical assistant, their phlebotomist, whatever it is that we're doing. And so we have to focus on their patient care. That doesn't mean we can't be nice to them and that we can develop a relationship with our patients, but we maintain that professional relationship. And again, we're always focused on achieving our patients' health care goals. That's what we're going to be working towards. Handling difficult situations. This is hard. So let's say one of our patients comes in and they've just lost their child. This is tough. You know, sometimes we do cry. You know, we're not going to sob and go, oh my God, this is terrible news, you know, and act crazy. But, you know, sometimes we will, you know, I can't imagine somebody losing a child. So it is going to affect me. But we have to be very careful because there's a very fine line and if we cross over that, it absolutely affects, the how we work with that patient and the effectiveness of the care that we're giving. And so please be careful. It's okay to say, I am so sorry, and then try to excuse yourself. But there's terrible things that happen. And we are going to feel, because we do develop a relationship with our patients, we are going to have reactions and feelings. And so we just have to be very, very careful. As we look at this again, understand your own behavior and reactions. You know, sometimes it's our own fault. Maybe we react differently. So we need to look at how we react to things and then maybe work through some changes to be more positive. You know, I know we have a very common tendency, if somebody says, boy, you're crabby, our first comment back is, well, just shut up. You know, we're very defensive. We need to be careful with that. We need to stop, think, is there something else I could say that would be a little bit more positive than yapping back at that person? So please look at that and analyze what you do and see if there's anything you can do to make yourself put yourself in more of a positive situation. The other thing that we have to do is separate fact from emotion. And this is really important. It's hard sometimes to have decisions made that hurt us or hurt our heart for someone. But unfortunately, based on the facts that we have, the situation calls for whatever has been ordered. Let's go back to Italy with this coronavirus. At one point, they said, if you're 80 years old or you're not getting a ventilator, that's devastating. How would you like to be the one to have to tell a patient that? You know, but unfortunately, the fact was they only had so many ventilators and they were saving them for younger people. 80-year-old people had lived most of their life, and they decided to try to save the people that were younger and can make a difference in the world. And so some of these things aren't easy, but we do have to look at facts and separate them from our emotions. The other thing we have to be able to do is accept criticism. And boy, is this hard for some people. I like to say constructive criticism, because people can criticize you in a very negative manner. And again, we need to stop before we say anything, put our thoughts together, and then respond, because our first response to that is going to be defensive. If someone has a good way about them, they'll be able to give you, be able to do the criticism in a more positive way. All right. We react gracefully. Yes, we may be ticked off deep down inside, but we really need to listen to what they're saying, because we can improve. We think we're doing everything okay, but they're observing us from a different place, and maybe that there's room for improvement. And so it's really important that we listen, we find out what things we could do to improve ourselves, set some goals, and then reach those goals. So you're going to be evaluated regularly throughout the program that you're in and throughout your professional career. So getting used to criticism is really important. Okay? The other thing that we have to talk about is professionalism outside of the workplace. You represent your profession both on and off the job. And this is hard for some people to believe, but it is. You do. You can't be wallowing drunk and throwing up all over the street because your patients may be walking by you and thinking, oh my God, that's my medical assistant. What is wrong with that person? Or that's the phlebotomist that drew my blood. How in the world can they draw my blood when they are this drunk? So it is really important that you think about those things. Be very careful with your social media. We talk about this during orientation to all the allied health professions. I'm going to tell you, I sit on a lot of committees, hiring committees at the college. And the first thing I do once I get their name is I go to Facebook and I look to see what they have posted, how they've posted things. Have they posted, nasty things? Have they showed pictures of them stinking drunk and half naked? That's a problem, because if people think, oh, that lady works at Allegheny College of Maryland and look at her, what are they hiring? That I really pay a lot of attention to that. And so do other employers. Please don't think that they're not checking, because they absolutely are. So you need to make sure you don't post photos of inappropriate behavior. Watch your language, okay? Saying horrible things and going on a rant, that is not helpful when people are looking at your page. Being rude or bullying in a way to some of the other people. Again, they're going to be looking at that. Oh, I'm going to go back for just a second. Sorry. So sharing too much about your personal life. We don't need to know that, that everything that happened last night. It's not important. Be careful with your political views. I know that sounds terrible, but, be careful. Don't be slamming other people, because I don't care what you are, but if you aren't able to be civil to someone, that's the problem that I would be looking at. Inflated ego. I'm so wonderful. I love all the pictures when people are, kissing and putting their lips out and pooching their lips. And I don't really understand that. But, that looks very self-centered. And so people will look at that. And I know it's a thing that kids do. But the thing is, you guys are going from kids to healthcare professionals. And so you need to be paying attention to those kind of things. All right? And professional leadership, you do not have to be in a role of authority to be a leader. I can tell you that. We always have leaders rise out of our classes. They are a classmate, but they are people that reach out and help each other, help the other students, are there to console other students. So you can absolutely be a leader without being that person in charge, right? So a leader encourages people to work together, to do their best to meet a common goal. So as I'm talking about that student, they're forming study groups. They're, trying to share notes. We've had students develop Facebook pages and teams on Teams to help each other, to learn to study and those kind of things. That's really amazing behavior. And that's something that would come out in an interview, that they were very good to their classmates. They were there to support and help them, and they played a leadership role within their program. Okay. One of the things that we think about when you see characteristics of a healthcare leader, you are going to have a high level of competence, and you're going to keep that level of competence. So you're not going to just learn the stuff and then never go back to it. You're going to constantly be wanting to learn more and more and more. You're going to make sure you commit to providing high quality services, showing you a willingness to recognize and support the work of others. This is so important, guys. I have worked for people who you do something really great and they take credit for it. And that is deflating for the person who did it. I always want to recognize somebody who went out of their way to do something. I'm not taking credit for it. That person should be getting the credit. They're showing wonderful leadership skills. So that's really important. Being able to believe that necessary changes and improvements can be accomplished. You may not agree with everything. I'm going to be really honest. We're moving to the Allied Health Building. That is the last thing we wanted to do. But we did it because in the college's eyes, that was best for the program and the college. So we're doing that. It's not what we wanted to do, but it's what we needed to do. Okay? So that's really, really important to be able to do. You need to be a role model of professionalism. Leaders need to be role modeling professionalism. So make sure you're not gossiping and talking behind people's back and showing up late and come in dressed terribly and wrinkled and smell bad. Those things are not setting a good example. And encourage others to do their best. If somebody's doing a great job, tell them they're doing a great job. It doesn't take away what you're doing. It just really gives them a feeling of accomplishment. And again, that's going to make them feel better, and they're going to provide better care. We just kind of talked about that. Ability to communicate effectively is very, very important. Communication is a key in the office. And if we're not communicating properly, it is a problem. All right, that is the end of chapter 15. Thank you very much.